Welcome to the new podcast. I'm Chris Goodwin with Insurance Pros, and in this inaugural podcast, I'm really incredibly happy to have my good friend Ron Gordon with Ron Gordon Insurance with me. What's up, Ron?
Excited to be here, Chris.
Man, I bet you were surprised or confused when I said, "Hey, come on up at 3 o'clock."
At 6:45 this morning, yeah,
Yeah,
with no reason to it.
yeah, and I was like, "Oh, today's my first podcast slash vodcast because we are on video. I think I'm gonna assume that that's on.
Yep.
Doesn't matter if it's not. We could deliver it. It's a video only. I don't know, but no, I was like, well, I know I have a lot to talk about when it comes to Medicare and insurance, but I'm like, well, what am I going to talk about it specifically? And I was like, well, let me recruit the first person I could think of who knows a lot about Medicare, my good friend Ron. Ron, you've been at it for how long?
Oh man, it's right around 20 years now. 20
Yeah.
years about this year. Maybe I might be close to 21 this year. So
Wow.
it's been a while, and you have been an unbelievable asset for me, leaving a company that I worked with for almost 14 years in the Medicare field, and you made the transition of coming out here as an independent agent a lot smoother than it would have been on my own. So I
Wow.
appreciate that.
Well, thank you. I mean, I wasn't expecting all those accolades. Or, there was one athlete that said, I don't want all the escalades, but he really meant accolades. But I appreciate that. And, wow, it's funny. I've been doing this since 99. So that's 25. May, it will be 25 years that I've been in business. So there's a lot of years of experience right here between the two of us.
Yeah, I would say a lot of great successes and some that aren't so successful. So I think we have a pretty good spectrum of experience that could help a lot of folks out there.
Yeah. Well, in that light, as an independent agent that you are, what are you running into these days that's interesting about, Medicare and when you're serving people? What's an ongoing theme or perhaps something that is, kind of prevalent right now that you're dealing with every day when advising people about Medicare, how it works and how it applies to them?
I would say one of the biggest things is there are lots of choices and lots of selection and lots of companies. So it takes a little bit of work to narrow it down to whatever program works best for that person. So I would say it's a good place. I mean, we're in a great place. I tell folks all the time here in the Kansas City metro area that we have great selections of plans and products, as well as we live in an extremely rich medical environment in general. Lots of good hospitals and providers here. So
Yeah, doesn't seem to be oversaturated. I would assume that, some cities, you probably have some difficulty with access and other issues.
We don't have to worry about that here. We have a lot of providers. I mean, but just like any other metropolitan area, you may have a wait or two for some specialties, but in general, I think we live in a great environment, and I think also every day being able to help folks figure this stuff out is very rewarding. I mean, I tell folks all the time, this is the first position I've ever had in my career where I feel good every day going home because I know that I helped somebody that day.
Yeah, it is an awesome feeling. And, man, it's very interesting how your clients somewhat become friends and somewhat they feel like extended family, man. And I'm assuming that you feel the way I feel it. There's a high level of accountability, and we want the best for our clients.
Absolutely.
Not for any reason. For several reasons, but just because we want the type of service that we would like to get ourselves, and we want their long-term best interests to be served.
Yeah, funny that you said that because when I got into this business, my mom was one of my first clients, and taking care of her gave me this feeling that I wanted to treat every client like I would want an agent to treat my mom. So I think that has served me well in following that particular position.
Well, that's funny. I have a very similar philosophy, and I tell people this from time to time, but even if I don't tell them, this is what I do. I say, I've got to make, let's say, I got to consult you and help you understand your Medicare coverage, or for that matter, other individual health insurance for people under 65. But I've got to share this information with you and help guide you towards a plan that makes sense and meets your priorities, as if I'm going to see you at Thanksgiving dinner.
Yeah, that's good.
Because if I'm going to see you at Thanksgiving dinner and I put you with a crappy plan, I don't like to, it's not a professional term, but, if I put you with a bad plan that doesn't make sense, and, you're having claims denied, or, it's not working for you, Thanksgiving dinner is going to be very awkward. You look at that family member, and then you kind of look down, and then you just got to go to the different room and grab a drink or something, and and try to avoid them. But yeah. I don't have to do that. Especially with under that analogy, I don't have to do that with our clients, because we are comprehensive, we're educational, and we help, to the best of our ability, help people fully understand what they are purchasing and why.
Yeah.
And even understanding the alternatives, so that they, say, okay, I didn't have that. If someone mentions it, or they run across a commercial regarding something that they don't have, they're like, okay, I don't have that, and I know what I have, and I know why I got it. And that's important to me. I'm assuming you're the same.
Absolutely. I always use the word preach, but I always emphasize to my clients that when they pick up the phone and need help, I will always be there. I mean, I may not answer the phone right then because, of course, yes, I'm working every day, but my clients know they will receive a call back as soon as possible. And I think that really adds to the comfort of their decision, knowing that you're there to help guide them through any questions or issues that they may have. And I think we both do a really good job of being there for our clients.
Yeah, well, and thankfully, I mean, there are hundreds of people running around there, so we don't have to try to say that we do a good job. I mean, our stuff is out there in terms of everybody that you serve, they're going to tell a story, whether it's going to be good or bad about you. So, my laundry is out there. I mean, and my reputation is at stake. So I guess anybody out of the hundreds of clients that we serve, I mean, will be able to speak to it, and I don't have to necessarily, say I do a good job or whatever.
Well, I think we both rely heavily on referral business from our clients. And if you're not doing a good job, your clients aren't going to refer their friends and family. It's funny that I am working right now on a couple of cases for some twins, but I have 4 of their other siblings as well. So this is going to be the 6th sibling that I have out of one family. And people don't bring their family and friends to you if they don't feel comfortable that you're going to do a good job. That goes back to the Thanksgiving dinner. Do you want to be sitting at the table with your brother and you've given him bad advice on how to get his Medicare coverage?
Right.
It's not a good situation. So it always brings me a great pride when I have family members refer their family to me.
Yeah, I agreed. Okay, so you mentioned something that's kind of important and interesting. You said there are a lot of options out there.
Yes.
And interestingly, I know some people take a stab at it and, of course, try to, kind of self-educate themselves. And that might be a good thing, especially, before they come to a professional. But maybe it's good to come to a professional up front, depending on what you want to call a professional, because you could get the wrong advice, or you could get somebody who's, got one product and everybody one size fits all. But when it comes to narrowing down all of these different Medicare options, let's stick to Medicare. What's your process, and how do you, help people kind of make sense out of all of these options, starting with, what the heck is Medicare and how am I supposed to do this? Because I've either been on an employer-sponsored plan, or maybe I've been on an Affordable Care Act plan, hopefully they navigated that all right.
Yeah. I would say, first off, I am extremely happy when I walk into a home, and I probably do 90% of my meetings in homes,
Mm-hmm.
and I have someone who has jotted things down, marked the Medicare and U book up, so I know that those people have put some sort of effort into, you know, taking care of themselves and learning what their next step is going to be with Medicare. Um, as far as getting started, I think you and I follow pretty similar processes. And we talked earlier, medication is really important for a lot of folks, and how their Medicare coverage covers their medicine can be the difference in thousands of dollars picking the wrong plan. So we both start with going to Medicare.gov. It's a great website and it's objective. It's not geared towards pointing you to any particular product. And we add their medications, and then Medicare, gives us the information as to how each company covers those particular prescriptions. And that's just the place to start, because most folks, the most expensive part of their health care is their medications, because that's something they're doing every single month. So if you have someone who really needs, brand name prescriptions, I mean, different companies can cover those significantly different, and they can be thousands of dollars. My next step is then looking at benefits, and tailoring those benefits towards a person's need. You may have someone who is extremely healthy, and they're more interested in benefits like over the counter or dental and glasses. Or you may have that person who is a high utilizer of services, who specialist copays are more important and hospital copays are more important, or cost of supplement, premiums is more important. So it's like we talked about, it's a lot of options. So it is really good to have someone who is very familiar help you start to navigate that system.
Yeah, I love what you said, and kind of to double down on your point, when you go to Medicare.gov, I like to call it the best taxpayer dollar spent, because whoever they use to actually kind of build the site, I'm assuming they, as a vendor that ultimately did it. It's a calculator, and it actually very objectively allows you to put in your prescriptions, your zip code, and the pharmacies that you like to go to, or you would go to, and it really kind of splits out and narrows down and shows you the most cost-effective plan that you could buy, all the way to the least cost-effective. Exactly. That's going to be terrible based upon any prescriptions that you might take. And that's one way that you could immediately narrow it down, because Absolutely. It's like, well, there's no reason to be looking at these plans where I'm going to be out $10,000 because it doesn't cover my drug. Exactly. So now you could just focus on the plans that are cost-effective when it comes to your prescriptions. Now you can go to those plans, for instance, and then see now which of these plans cover my providers, and then let's talk about out of pocket, and let's talk about additional benefits. And right now we're kind of talking around Medicare Advantage, but that same thing for prescription drug plans.
Absolutely.
It's an incredible tool, but what I find is interesting is a lot of people that I deal with, which rightfully so, they're not familiar with Medicare.gov. They may have gone there, but if you don't know what you're looking for, a lot of times you don't even know how to get through and get to the point where you could see those plans and those co-payments. So you kind of need a Sherpa. Yeah. I mean, for a lot of people do, and unfortunately,
Well, I mean, like I explained to my clients, even now, I mean, every year when it's time for me to re-enroll for my own personal health care, it's a thought process. So just because you're a professional in this business doesn't mean that you don't even have to do the same for yourself. Most folks that, November, December time of the year when it's open enrollment for their company are stressing that they're paying too much, or am I going with too big of a deductible, too big of an out-of-pocket cost? And so therefore, when you come to Medicare, it's different. you do need an initial education on that process and the products. So I always stress to my clients, it's especially when they're coming from, just getting to Medicare, this is an education process, and I am here because this is new to you to make sure that you navigate this process well.
Love it. All right. Well, you know what? I don't want to make this boring. So for a lot of people, a lot of people probably got some meat out of that right there. I mean, and that's the good stuff and the important stuff. But I want to keep it light and entertaining. So first of all, let me think about this. So I need your help, and we might not get to the conclusion today, but this podcast. I mean, one of the first things that the production boss Watchman mentioned is that what's the name of the podcast? And I was like, oh, I don't know what the name of it is. So what do you think? What are some ideas, or where can we go with the name of this?
I mean, that's something maybe we should let stew a little bit.
Yeah.
And
Wow.
figure that out. That's probably something we should have thought of before.
It's called what do you think? What do we call it? Like New Heights or something like that. I might be taken.
Well, I mean,
but you know what? We get so many hits if we just named it New Heights.
But would they be
but
for
it
the
wouldn't
right
be
reason?
a Medicare group.
That's what I'm saying.
It might not be a Medicare group.
Would it be for the right reason? They might think we're some sort of counseling group or rehab group. New Heights.
No, isn't that the Kelsey thing? Yeah, so the Kelsey brothers, theirs is called New Heights.
Oh, okay.
So then if we named it New Heights,
Oh yeah,
then
we would
so many
piggyback off
hits.
of there.
or make it something similar. New Height. Just,
Take off the
take
S.
off the S. But
I'm sorry, Travis. We're gonna steal from you. No, I'm just kidding.
well, yeah, somebody I just heard a podcast where somebody was mentioning that people are going into barbershops and asking for the Travis Kelsey cut, and some people were fairly offended. They thought that's a fade. That haircut's been around for years,
Decades.
Yeah. So anyway, that might be in the dark.
I've heard that actually. And Travis spoke up, to his credit, that he did not invent that haircut.
All right. Well, we might be losing some people on this, but I'm trying to keep things light. I'm really,
that's good.
And one of the things I was actually telling you earlier is that one of the things I really love about what we're doing right now is it's just changing things up a little bit. And, I get to talk to people every single day about Medicare and individual health insurance, group health insurance, dental insurance, vision insurance. But I need to mix it up every now and then. And I love talking about this a little bit, talking about what's going on. I mean, in the future, we could talk about client experiences.
Absolutely.
And topics. There's so many topics that are important when it comes to Medicare, questions that people have. But I like kind of chopping this up so that maybe in this format, some people will capture some
good information.
Good information. So.
We talked about earlier, there's so many options and reasons to pick particular, plans and directions with Medicare. One thing we did talk about is it's good to rely on friends and family for initial general information, but you should definitely always look into all the aspects of whatever plan or situation you're going to choose based on your own individual situation, because you guys are, you and your brothers and sisters or friends are taking different medicines. You may have different financial situations. Usage is different. So you always, it's good to get a good start with referral information from friends and family, but that's just your starting point. You definitely want to go, towards, you may want to look at those different directions, but make sure you key in your individual reasons for needing that coverage.
Yeah, thank you for bringing us back around to the adult topics here, because yes, uh, this is something that happens a lot. Is that people who go on to Medicare, um, and who knows how they got there? They tell their friends and family members, their experiences, and sometimes in a context that is confusing or probably not right, because Medicare and the purchase of Medicare insurance should be a customized
Absolutely.
process, because what that friend or family member is taking and what they're experiencing might not be your experience. We have people who tell their friends, "Oh, you got to get this plan because this plan, all the drugs are free. All the drugs are free." Well, yeah, maybe that person is taking generic only drugs and they're going to a specific pharmacy. But guess what? And I know that some plans, oh, wow, if you go to CVS, the drugs are free.
Yeah.
But if you go to Walgreens, you're not covered at all.
Right.
I mean, that's, I'm thinking about a specific plan. And if somebody actually tells their friend or family member, all these drugs are free, they're not thinking about, well, what drugs do you take? Are you taking Jardiance, or are you taking, I don't know.
Xarelto.
Yes. Or anything with a song, Sky Rizzy, I mean,
Well, I you know what? It's funny because I do tell my clients, and it's a little bit generalized, but if you see a prescription on television, ask your doctor for something else, because you are paying marketing that is going to be an expense, and in some cases you can't avoid it.
I was going to say sometimes you can't. There's like nope, you can't get something else.
But a lot of times there may be an alternative to a $400 a month drug in the generic aspect. So that's a huge aspect of it too. Just you have to be careful and you have to pay attention. And you have to ask. You should have a really good relationship with your providers that you can ask those questions to make sure you're in the right place.
Yeah, I fully agree. Two things that come to mind outside of people who share that, oh, you got to buy this plan. I get a couple of people who maybe their spouse went on a specific plan, whether that's a Advantage plan or prescription drug plan or whatever. And people automatically think in some cases, well, my spouse has this, I need to get this. I need to get the same thing. And you know what? Depending on their drugs, their utilization, providers, other factors, they might not need to get the same thing as their spouse. As a matter of fact, it could be a financial detriment. There are no household discounts on prescription drug plans, or even, in Medicare Advantage plans, there's no packaging of it. So, you shouldn't necessarily say, oh, you know what, she's got this, so I better go on and get the same thing. It's worked out for her. Do the research, and if necessary, do the research with a professional. And I wouldn't say if necessary, preferably, so that you don't make errors. Use a professional. And again, I'm getting biased, and I'm also thinking too far ahead, but don't just use any professional. Use someone who works with all of the carriers. I think somebody who says that they work in Medicare, I think it makes sense to ask, what carriers are you contracted and licensed with? Because if somebody's like, I got company A and company B, and that's where the conversation ends, you might want to reconsider, and keep talking to other professionals. Maybe you could listen to that person, but I don't even know if I would listen to someone if they said, yep, this company and this company.
Well, and that goes back to what I was talking about a little bit earlier, and I barely touched on it. There were 13 years that I worked for a specific health insurance company as an employee. And when I was in that situation, that was the only company's benefits that I could share with my clients. I could not sell other companies. And I still know independent agents who still will only contract with one or two companies. And just as I told my clients when I left that company, I left the company for them.
Right.
Because you cannot service everyone with one company's plans. It's just impossible, not if you really want to do a good job. So I'm a firm believer that you should have a well-rounded agent who does know the landscape of the area, not just the landscape of one or two companies.
And, I'm well-rounded because I'm gaining weight. I got to figure out how to turn things around. But anyway, but this is a good, I love what you said. But this is a good place to, kind of make a little stopping point. I would say, hey, we need to pay some bills, but we don't have any bills yet, like where, there's advertisers and things like that.
I will love it when we have to stop to pay the bills.
Yeah. But all right, let's take a little break here and then come right back. And then, I'm not even going to say we're going to talk about this. Let's brainstorm what we could really pick up on to make this even more exciting and informational for the people in our inaugural podcast.
Sounds good.
Also known as a Vodcast, because look at us. All right. All right. We're back. Now, there's a really good song. I'm trying to remember the artist. It is Never Mind. I lost it. I think it's the guy who has the hat with the 3 on it. He's a rapper. He's an independent rapper. Chance the Rapper.
Oh, Chance. Oh,
and he has a song, and it says, "We back, and we back, and we back, and we back." That's a pretty good song. He's very
he's talented,
multifaceted. He's very good. I like that. I like him as an artist. I'll try to remember his name.
Yeah.
Chance the Rapper.
He definitely doesn't sound like anybody else.
No. So, we kind of promised going out into the break that we come back with something entertaining, but educational. And I think that it's somewhat entertaining, somewhat educational to talk about, well, first of all, when does it make sense to start talking about and start thinking about Medicare for most people? So, and to me, that's not the entertaining piece, because the entertaining piece to me is, avoiding, a lot of the traps that come with all of the mailing. So let's talk about that second, in terms of like how much information is out there. And if you put your information in the wrong places, you could forget about your cell phone and your email address, because you're just going to get bombarded.
Yeah.
There's already enough bombardment. So in your opinion, Ron, when should someone start getting an education on Medicare? When should they start thinking about it?
Well, I would probably say they're going to getting hit with mailings a year to 6 months before they turn 65. I say 6 months prior to getting ready to take care of your Medicare is a time to start looking, maybe feeling out with family and friends if they have a trusted source that you can talk to. That will give you plenty of time, I think.
Okay. So 6 months before you're 65 years old.
Or, remember, you can keep working and carry your group coverage, and you may not be 65. So you may even just 6 months before you want to start your coverage, whether you're turning 65 or retiring.
Right.
I would say is a good time to start looking.
Well, what's somewhat interesting, and I somewhat agree with that, but I think it's going to be difficult for people to hold off that curiosity about what am I going to do. And really, you have to cut off all of the advertising and different things that are going to get in your head at the pass by, trying to get a hold of that information. And that's really specifically why I teach classes throughout the area. And frankly, somebody who's 63 years old, and I'm not really trying to, rush the process for somebody, but somebody who's 63 years old, for instance, can go to a class. They could learn about Medicare, and they could pocket and take any information home with them and have a general understanding. And now you kind of are what in my mind the in control of the information, and you're not as much in the dark, because people are going to start getting things in the mail that says you have to sign up, and don't be penalized, and they're going to get information that is going to be disconcerting in an attempt to get those people to call them for information, and we kind of know what that's about.
They want to create a sense of urgency even before there needs to be a sense of urgency.
Right.
So, no, you're right. I do think that person that takes advantage of opportunities to go to classes and things like that a year to 2 years out is definitely in a much better position than those that wait till it's time. But I mean, we are a nation of procrastinators. So,
yeah.
I know, we both do educational Medicare classes, but I would say 70% of the folks in the classes that I teach are less than a year away from needing.
Yeah, I agree. I feel that's the same way.
But smart. If you really are interested in and you don't want to be rushed and you want to have time to make a really good informed decision, you start looking earlier.
So I didn't anticipate asking this question, but in that light, how do you feel when somebody who's 62, 63 years old contacts you and says, hey, I want to talk about Medicare? Because, they're pretty early. So how do you treat that?
It depends on their level of interest. I mean, if they really want to start learning at that time, I'll put together some packages for them, whether it be Medicare Supplement or Medicare Advantage or prescription drug plan information together so that they can get an early start on it. But I also always advise them, if you're 2 years out, things can look significantly different by the time you actually are time to get it. So it's good to start early and kind of get a feel for what you're going to be looking at. But that landscape is definitely going to change if you're 2 to 3 years out from turning 65 by the time you get there.
I would agree because, if I end up talking to someone and they're like, okay, I'm going to go on to Medicare soon, some people confuse early Social Security with, being able to go on to Medicare. And some people have to be reminded that, outside of being on Social Security disability for 2 years, at which time you can go on to Medicare. Well, other than that, you have to be at least 65 years old to join Medicare.
Yep.
So sometimes I might tell somebody, yep, you're pretty early. And yeah, a lot of the things that you might learn, are going to be, kind of irrelevant to you for a while, usually maybe, 6 months or so before you're turning 65 would be a really ideal time. If you want to go a little earlier to do some long-term planning because it's budgeting and things like that, then I'm always open to it. And frankly, I'm a somewhat of I'm going to call it bleeding heart. I want to, I'll talk to a lot of people. So, somebody I know I'm 63, but I want to talk to you about Medicare. I'm kind of almost going to be like, well, all right, let's go ahead and schedule.
I will talk to them. I will put, like I said, information together, because if you're helping someone kind of get a feel for what they're going to be looking at down the line, they're going to kind of trust you to help them make that final decision as well, because they start feeling comfortable that you provided them with a way to get to where they're trying to go. So for me, I'm not going to put a ton of time into it because they're so far off and so many things may change. But I am really happy to go through some preliminary things and give them some, like I said, send them out some examples of things that they may have available to choose from. Right. But also, again, stress to them. I mean, even if I'm talking to someone a year out, I know that next year, calendar year, benefits are going to change. So I always, make sure they understand what you're looking at today as of next January can be significantly different.
Yeah, that's funny that, I had another thought that came to mind. I'm guessing that you had a similar circumstance or circumstances with several people. Every now and then, I have somebody who's not quite 65. They're turning 65 the following year, and they'll contact me during the annual enrollment period, October 15th through December 7th. And for those of you who are not familiar, that's when, if you have a Medicare Advantage plan or if you have a prescription drug plan, you can change your plan in favor of another plan, no questions asked, for a January 1st effective date. But quite a bit, I'll get people who maybe they're turning 65 in June of next year, and they say, I want to sign up for Medicare because I was told I got to do it now because this is the period, this is the time to do it. And I'm like, no, you're early. You know, that's for people who are already on Medicare and not people who are going to be turning 65. You have, you know, you have a 7-month window. You have the 3 months prior to the month of your 65th birthday to enroll in Medicare.
Right.
So we could do that at that time. You are not required to do anything during the annual enrollment period because you're not on Medicare. This is for people who are on Medicare who need to make a change.
Right. Well, I mean, I don't think that Medicare does a good enough job letting people know that there are things called special election periods.
Yes.
You know, as far as
I call them special enrollment periods. But if you call them special election periods, that's fine with me.
SEP. And those periods give you an opportunity to make changes when you're having different circumstances other than our regular you move to a different area that your plan isn't serviced in. I mean, you get a special period. You get approved for low income subsidy for your prescription drugs or Medicaid coverage. So it allows for you to have certain circumstances that allow you to make those changes outside of that annual enrollment period.
Loss of employer coverage.
Exactly. So when you leave that company you've been working for, even if you're 65 or older, it's going to open up a period for you where you have guaranteed issue to Medicare.
Yeah. So this has been on my mind because we started down this road. People maybe 64 or so start getting a lot of mail.
Yes.
From insurance companies and maybe other, interested parties surrounding insurance companies, maybe agencies or, lead companies.
They do a really good job of making their marketing material look like it's coming directly from Medicare.
Yeah, I've seen that.
But yeah, you're gonna get bombarded. I mean, and I think people are really surprised by the number of options and things that they're getting hit with in the mail, based on it's time to enroll or they're even getting close. So it can be extremely overwhelming, when it doesn't necessarily need to be. But if you're not educated, in that type of situation with Medicare, you're going to see all this stuff and go, holy smokes, what is a plan A through N on a Medicare supplement, and what are all these Medicare Advantage plans, and what's a SNP plan? And I mean, there are so many options and acronyms that it can be extremely confusing. So
yeah, I think that generally, I think you would agree that most of the marketing material that people receive starting at around age 64 is really designed to get that person to act, to pick up the phone, and to contact them so that they could be the first one to the trough, per se, or just the first one to get an opportunity to try to get you on their Medicare plan. And
as we both know that, you can get all of that information, as we talked about a little earlier, without giving your specific identifiers.
Right.
Because like you say, once they get that identifier, man, it's over.
Oh yeah.
You're on everybody's marketing list. The mail doubles, the phone call increases, and it doesn't matter if you're on the no call list. They seem to get by that.
Yeah, and well, and in that light, this is the thing that I think is a huge takeaway that I've offered before in classes and everything. But a lot of times, as people get closer to Medicare, or maybe they're already on Medicare and they want to look at rates. Well, some people actually go online and they start looking for rates. Maybe you Google Medicare insurance rates or something like that.
Mm-hmm.
And a lot of times, in order to get rates, the site that you're going to might ask specific information. What's your name? What's your email address?
Mm-hmm.
What's your date of birth? What's your address? And what a lot of people need to understand is most of that information is not required to provide you with Medicare rates.
Not at all.
Your zip code and your age is all that's really needed.
Mm-hmm.
Obviously to see if you could qualify for certain plans, you would need to go through underwriting. But just to get rates, they don't need all of that information. Typically, that is a lead company.
Mm-hmm.
And if somebody actually puts all of that information in just to get rates, what they are doing is they're giving their information to a company that is selling their information to an agent like me or you,
Mm-hmm.
although I don't buy leads. I don't have to. But that's giving their information, let's say 8 to 10 agents
Yes.
get their information. And then next thing you know, you could say goodbye to your email address because you're going to get bombarded with email. You could say goodbye to your phone because your cell phone is going to get text messages, you're going to get calls, and everybody is trying to compete to get your information. And
Mm-hmm.
there's so much regret surrounding what happened. And people get angry and
Right.
they don't know that that's what they did.
Yeah.
And sometimes, believe it or not, a lead company is buying that information from another lead company.
Mm-hmm.
So it's spider webs. So if you have one lead company that's sending your information out to 8 to 10 people, and then maybe a couple of those are lead companies and they're reselling it to 8 to 10 people. Now all of a sudden you've got no less than 50 people calling you or have you on their list. And then sometimes it's some innocent broker or somebody who thinks they're buying the lead and I just want to talk to you about your Medicare. And they're like, why are you calling me? I wish you people would just stop calling. And then that poor person is like,
well, and
I'm sorry.
also not even just online. I mean, the little more information sheets and cards they open you up to, and not only are you giving them your information by filling that information out, you're giving them permission to use that information.
That's true. And if you don't
out.
read the fine print, sometimes you might not be aware that you are given the okay.
Mm-hmm.
Let me mix this up and say that what I'm looking out here at our production crew, man. These guys aren't I don't know, they're young, they're not they're not paying particular attention. I'm wondering if this is boring. It should be. I would hope so. I hope I'd be thinking about something totally different. And, it's like, man,
it's hilarious
because
I will say this, looking at the young gentleman out there. I was saying this the other day. I just got a call from one of my friends, and my 40th class reunion is coming up this year.
Whoa.
And
40th class reunion.
And we were joking
you are
how how when we were in our 20s, 50 seemed so old.
Yeah.
And so far away from Medicare. And now it's like, man, with my insurance costs for my personal insurance, I can't wait to get to Medicare. I'm not in a hurry to get older, but I'm in a hurry to get some savings on that.
Right. Yep. Well.
So, yeah, they're young. They're indestructible. They don't got to worry about health insurance right now.
Yeah. Well, okay. So there's another, I'm interested in where you want to go with this next, because I had something in mind, but I lost it. I keep on having these thoughts and losing them. Didn't know Chance the Rapper. What are your thoughts?
Well, I mean, I thought this was an excellent first attempt on our blog, whatever it's video or whatever.
It's Vodcast, man.
Vodcast. So I'm looking forward to future casts, and making sure we give good information out to folks in an entertaining manner.
Well, we better get more entertaining. I'm just like I'm not entertained yet. I want to say something.
Well,
I want something that's gonna hit hard. Make sure that people are laughing, enjoying this.
Well, I mean, I want to be entertaining, but I think good information, even if people aren't laughing, is entertaining as well.
Maybe
so.
this could be good sleep therapy. I mean, somebody could be like,
hey, you guys want to go to sleep? You having trouble sleeping?
Let's talk about your Medicare.
Turn on the video
Let's
cast.
talk about advertising Medicare.
No, I think this is well worth people's time, to sit down, and I think we've had fun, and I think we've kept it light. And I think going forward, we will be able to do the same. So.
Well, maybe by the next time we talk, I'll have thought about that topic that I thought was really exciting.
I probably will do I will probably do a little better and be a little more prepared if I don't get the call at 6:45 the morning of the show.
Hey, you got it probably 7:30 when you woke up.
Yeah, I didn't look at my text till 8 actually.
Anyway, all right. Well, we're gonna go to break. We probably aren't gonna come back because we're out of content for the time being. I don't want to just sit here and filibuster.
I think we've had a good first show again.
I think that I did.
I enjoyed it.
I don't know. I feel like I did a better job than you, to be honest.
Well, I guess that means I'm going to have to step my game up a little bit.
No, I really enjoyed this. I could not have actually done this without you, man. And I just appreciate what you do for your clients. And, I feel like we're out there helping people. Hopefully people feel the same.
Well, I always, and not to toot my own horn, I try to associate myself with other good agents, and having a network of other professionals that you can rely on as sources, because even there's so much out there, we even need, questions answered and things. So when you have a good connection with folks, and I think I think our partnership has been pretty good as well. So, like I said, I'm looking forward to doing this, in the future, and hopefully you'll have me back.
Yeah, and you know what I'm looking forward to? Ron and I are going to Las Vegas in April to the Medicare conference. I mean, and it's like, I got to go to Las Vegas. And that's where the Medicare conference is, a huge one. And I do it. I'm not doing it because I want to go have fun. As a matter of fact, I just don't really enjoy Vegas like I used to. But I'm going there to get really good information. Yeah, exactly.
No, I am. You've been trying to talk me into going to this conference for a few years now, and I really think this year is the year that there's going to be a lot of information and some opportunities for changes coming down the pike that we definitely together want to make sure that we're prepared for, and we want to be the best educated agents that we can be for our clients.
Yeah, so. I mean, if you're not continually educating yourself, you're not going to be,
especially in this business with the changes every year. So.
Yeah, absolutely. So, all right, we're going to sign off. Thank you for listening, and
appreciate you guys.
Looking forward to the next time. We'll get better.
Thanks for your time.
All right.